The past year has put our kids in situations and drawn out emotions many never saw coming. We want to help. This is Hope, Help, and Healing Our Kids, a 13 Connect special. I'm Dave Courvoisier. Over the next 30 minutes, we'll talk to a wide variety of experts who will help us look at the emotional toll the pandemic has taken on our kids this past year, from behavioral health issues to substance abuse issues to the most up-to-date information on youth vaccinations. We're here to assess the damage from a year in lockdown and map the road to recovery. Hope, Help, and Healing Our Kids starts right now. And now I'm being joined by Jimmy Monahan, the Executive Director of Olive Crest. Jimmy, thanks for joining us. And for those who aren't familiar, what is Olive Crest and what kind of services do you provide in this community?
Well, Olive Crest has a great amount of services. We are a foster agency, but we also really focus on family preservation and helping families heal and stay together and get the resources that they need to be strong and healthy and vibrant in not only their immediate circles, but in our community as well.
I know I've run across Olive Crest before doing the Wednesday's Child Reports. Now, we've seen a rise in domestic violence incidents during the pandemic. Why is that?
Well, isolation. I mean, isolation is the number one cause for neglect. And so when you're isolatory and you don't have that sense of community, that sense of family, that sense of help around you, it can be maddening, I mean, to say the least. I think all of us have experienced some negative effects of the isolation, and when we don't have the proper coping tools in place, when we don't have the proper support systems in place, it can become pretty negative.
Because we're all meant to be in relationship, aren't we?
Absolutely.
Well, if you're a victim of domestic violence, how do you get help? Where's the best way to go to get help?
Well, for domestic violence specifically, I would call Safe Nest or Shade Tree. Olive Crest is more of the family preservation piece, trying to go in to prevent abuse and neglect, trying to go in before we get to the place to where people are triggered by what's going on around them and then they explode and have the intermittent anger and stuff that happens where they feel out of control.
One of the objects of the frustration of this isolation, though, can be children, and those kind of abuses, emotional, verbal, can have long-lasting effects on a child, no?
Oh, absolutely. And there's a lot of research coming out of the CDC that suggests that the parental figures in the home's mental health speaks directly to the children's mental health. So really making sure as parents and as caregivers, as the primary people in our homes, making sure that our mental health is okay. Mental health has such a bad stigma historically, and we're really seeing the shift that it really is okay to say, hey, you know what, I can't do this by myself and I need some help.
Yeah.
And so I would encourage people to reach out.
What sorts of signs and signals should students and teachers and aunts and uncles and grandparents, friends, neighbors look for if you suspect a child is being abused?
Well, you know your child better than anybody. So you can ask. The people, the caregivers around them will be able to see a withdrawal. There's usually a withdrawal. There's behaviors that will be acted out on that aren't typical for your children or for the people who are in your area. We need to look around for just drastic changes in behavior. That can be intermittent explosiveness. It could also be isolation and withdrawal. And the biggest thing we got to do is we got to ask. When things feel off, chances are they're off. So we got to ask and we got to be participatory in our children's lives.
Jimmy Monahan, the Executive Director of Olive Crest, thank you so much for that advice and your perspective on this. It's a tough one. We appreciate you.
It is. Thank you so much.
Well, you can find more information on our website, ktnv.com/healing. 13 Connects, Hope, Help, and Healing Our Kids is sponsored by America First Credit Union and Subaru of Las Vegas. We want to warn you, our topic today, this conversation, will be about the sensitive subject of teen suicide and prevention. I am joined now by Caroline and Lauren Edgeworth, the Hope Means Nevada Teen Committee co-chairs. Great to see you both.
It's nice to see you too.
Now, either of you just jump in with answers to my questions. For those who don't know, what is Hope Means Nevada? What does the organization do for the community?
Hope Means Nevada works to spread awareness around mental health, especially among teens, and we're working to destigmatize these conversations and normalize them.
Pretty important to keep those conversations going. What drove you both to be involved with Hope Means Nevada?
Well, at the beginning of the pandemic, we noticed a change in mood with all of our friends because this is such like a sudden change for us and we had no idea what we were going into. So I think it was really important for us to get involved in this. And it's something that's not normalized amongst teens. So I think it's really important that we start to spread awareness amongst our team members.
Not something teens talk about much, I guess. Now, there's been a rise in teen suicide this last year with the pandemic. I guess that's the main cause for this. Why do you think that is?
I definitely think it's a main cause. It's mainly caused by the isolation the pandemic has caused us. Some of those former outlets, such as sports, spending time with friends, just hanging around other people, that physical contact has been greatly reduced during the pandemic. So I think for those reasons, not being able to go into school has been just a really big factor, especially in the suicide rate, which is so devastating.
If you sense that you're struggling with something like this as a teenager, you're thinking your mental health isn't where it should be, where do you go? How do you get help?
The first step I'd say is reaching out to a friend, a counselor, a parent. And I think it's just really important to emphasize the fact that every teen has people who will support them and who love them and care about them. And I know sometimes it's really scary taking that first step, but once you start reaching out to a friend, you can be able to start getting help from different people.
I know that friends can help friends with this. What are some of the warning signs of suicidal ideations that teens can spot in their friends? What are some signs that parents should look out for?
There's definitely not a blanket statement that can just cover these signs, but I'd say for the most part, if you notice a change in their behavior, their mood, their normal daily patterns, their sleep, I think those are great ways to start. But additionally, I think just checking in on your friends constantly. That's our motto, ask five, quote means Nevada, which just means to check in on five of your friends and move past those typical surface level conversations and just get to know each other and make sure you guys are truly doing okay.
And parents, what should they look for?
Parents, similar, just like similar to your friends, if you notice that your child isn't acting the same way, don't have the same motivation, not doing as well in school as they usually are, those are usually some of the first signs of someone who's struggling.
And finally, Governor Sisolak signed Senate Bill 249 into law. It's a law that will excuse absences for mental health days. We just had this earlier in our news. Also gives students access to the National Suicide Prevention Helpline. Is this important? What does this mean for your cause?
This is something that's so important and it's helped normalizing suicide and the talk of mental health amongst teenagers. And I think that's a really good step in the right direction because we just want all teens to know that mental health shouldn't be something that's isolated and we should be able to talk about it freely. And the National Suicide Hotline, it's something that's so simple, but something that's so important to have for each teenager.
Yeah, I definitely think that it's a great step in the right direction. And sometimes teens just need that day off, that day to recollect their thoughts, if they're stressed about schoolwork, friends, anything in their lives. So I think it's a really great step. And I'm so happy that our governor was able to do this along with Senator John Darrell.
Yeah, Caroline and Lauren Edgeworth, the Hope Means Nevada Teen Committee co-chairs, thank you so much for being here and explaining more about how this can work for all teens. Thank you very much. You can find more information on our website, ktnv.com/healing. 13 Connects, Hope, Help, and Healing Our Kids is sponsored by American First Credit Union and Subaru of Las Vegas. Remember, you are not alone. You can help. Call 911 for immediate help. The number and website for the Suicide Prevention Lifeline on your screen now. The information for the Trevor Project, which helps LGBTQ youth, also on the screen right now. We'll be back with more of this 13 Connect special after the break. Thank you for watching Hope, Help, and Healing Our Kids, 13 Connect special. For more information on all the topics we're discussing in this special, visit our website, ktnv.com/healing. Some young people have been coping in unhealthy ways, even using substances, abusing substances, and we have reported a young teen died after an alcohol-related incident earlier this year. So I'm joined now by Randal COLQUITT, an anesthesiologist with CARE Coalition. Good to see you, Randal.
Yeah, good to see you. Happy to be here.
Doctor, what is CARE Coalition and what does it do for our community?
Yeah, so real quick, my dad is Randall Colquitt as well. I'm his son,
Oh, okay.
but I work for CARE, just to throw that out there. But CARE Coalition is a nonprofit organization committed to substance and alcohol abuse prevention in Clark County. CARE is actually an acronym, meaning connectedness, awareness, resources, and education. And our mission is to increase public awareness of the effects of drug and alcohol misuse by educating and supporting youth, adults, the community at large, and drug prevention agencies in Clark County, thus identifying and promoting healthy behaviors and reducing substance misuse in our community.
Thank you for that. You know, there's been an increase in people of all ages abusing substances and alcohol during the pandemic. I think that's pretty clear. The cause seems obvious, but is it really? I mean, what caused it?
Yeah, so looking back at the COVID-19 pandemic and throughout the whole year of 2020, really isolation caused it. People weren't going out; they had to stay at home, and they were fearful of the unknown, and so they were turning to particular vices such as alcohol and substance use to cope. So really, isolation caused it. Is the simple answer.
So, if young people are struggling with substance abuse or alcohol, how do they get help?
Yeah, so CARE Coalition is an organization and we provide resources. So youth and adults can reach out to CARE Coalition at info@carecoalitionnb.org or by phone to receive resources such as where to turn to mental health professionals, healthcare professionals. They can really reach out to us for a one-stop shop, so to speak.
All right, and for parents, relatives, friends, anyone who's nearby someone who's abusing, what are the signs to look for in that young person, the adolescent, teen struggling with substance abuse?
Good question. So things to look for would be like erratic behavior, sudden change of behavior, mood swings, sudden change of weight, so severe alcohol misuse, stipends hunger, so you become less hungry when you drink, when you abuse drinking. So it's like sudden change of weight, for instance, would be, and erratic behavior would be some signs to look for.
So you're pretty sure then you've got a relative or maybe a son or daughter, brother who is struggling. What do you do? Confront? Do you intervene? How do you handle that?
Yeah, good question. Because substance use disorders are a disease, and addiction is a disease, you want to be careful when approaching someone that you may know or love that's struggling with this. You don't want to judge. You want to listen. You want to recognize and help them to recognize that what they're going through is real, because it is real. And then you want to offer to help them find professional support, whether that be mental health support, actual practitioner support, healthcare practitioner support. And then you also want to help them look for underlying issues that are pushing them to misuse alcohol or substances.
And for those who are enough aware, self-aware to know that they're getting in trouble, how do they stop before it gets out of control?
Yeah, so I'm going to go back to the last question. Before you get out of control with substance use and misuse, you want to recognize that addiction is a disease and that it can be solved, so to speak. And then once you get them to recognize that it is a disease, you want to help them to pay more attention to their habits and to find support if they need it.
Boy, great answers. Randal Colquitt with CARE Coalition. We really appreciate your answers to these questions, these tough questions. Thank you very much for joining us today.
Yeah, thank you so much for having me on.
We'll be back with more of this 13 Connect special after the break. Thank you for watching Hope, Help, and Healing Our Kids, 13 Connect special. For more information on all the topics we're discussing in this special, visit our website, ktnv.com/healing. And right now, health officials are encouraging parents to get their kids vaccinated, try to stop the spread of COVID-19. I am joined now by Dr. Cami Larsen, a pediatric specialist with Nevada Health Centers. Good to see you, doctor.
Hi, thank you. It's nice to see you too.
And for those who don't know, what is Nevada Health Centers and what kind of services do they provide here in the Valley?
So Nevada Health Centers is actually Nevada's largest federally qualified health center, what other people would call a community health center. We're spread all through the state, not just in southern Nevada, although we do have several locations here in Clark County. And our mission is basically to provide quality healthcare to those who may not be able to access it otherwise. So we provide primary care services, dental services, mental health services, anything that you could think of, from pediatrics to adult care within different locations in the state.
Doctor, does the data still support the general early findings that most kids are able to tolerate COVID-19 better than adults?
So yes, most children, thankfully, are able to tolerate it better. However, it's not harmless. And there have been a good number of kids who get severe reactions to the virus. Multi-system inflammatory syndrome, for example, has affected more than 3,600 kids across the country. And there have been more than 330 deaths in the pediatric population from COVID-19. So while the numbers aren't quite as staggering as they are for the adult population, it's still not a benign illness in kids.
Got to take it seriously. Now, vaccines are currently available for kids 12 years and up. Some parents, though, are understandably concerned about the vaccine, how it might impact their kids. So what are you telling parents?
You know, we're trying to explain to parents that we hear them, we understand their concerns. We want to validate the fact that they are concerned. You should be concerned anytime you're giving your child a medication of any kind, whether it's a vaccine or anything else. But we really want to stress the fact that the vaccine is safe and it's effective. And we've looked at the data. It has been studied, and we want to prevent any kind of serious illness that we can. And so, even for children who may not be as severely affected by the virus, it's still important to prevent any major any major illness, and we do that through vaccines.
Does it seem that any one of the available vaccines are better than another for children?
Currently, the only vaccine that is approved for children 12 and older is the Pfizer vaccine. There is some hope that the Moderna vaccine will eventually get its approval to be used as well in the teen population. But as far as the pediatric kids go, the 12 to 18-year-olds, it is the Pfizer vaccine that we're giving.
Okay, last question real quickly. Any specific side effects from the shot that we should know about for children?
The side effects are pretty typical for kids, the same as they are for adults. The most common things being body aches, headache, fever, joint and muscle aches, maybe some nausea, things like that, discomfort at the location where the immunization was given, but generally fairly mild to moderate side effects. But most kids do get some range of that after the vaccine is given.
Dr. Cami Larsen, a pediatric specialist with Nevada Health Centers, thank you for your perspective from your side of things. It's good to hear that. Thank you so much for joining us today.
Thank you.
We'll be back with more of this 13 Connect special after the break. Thank you for watching Hope, Help, and Healing Our Kids, a 13 Connect special. For more information on all the topics we're discussing in this special, visit our website, ktnv.com/healing. Kids and teens have a lot of emotions and may not know how to properly work through them all the time. That can lead to behavioral issues. I'm joined now by David ROBECK, the CEO of Bridge Counseling Services, to talk about some solutions. And David, Bridge Counseling's been around for quite a while in Las Vegas, but for those who might not know, what kind of services do you provide for the community?
So you're right. Bridge Counseling is the oldest behavioral health agency in Southern Nevada, and that means that we provide mental health and substance abuse treatment. But beyond that, we have a psychiatrist on staff, a nurse practitioner that does medication management and checks for medical issues that we can do screening and assessments. We also have targeted case managers here as well that help our clients with the challenges of transportation and housing and employment as well.
Well, so as we mentioned, the pandemic has been pretty hard on the population of children in general. So what are the behavioral issues that counselors say they're seeing the most in young people?
You're right, and I'm glad you said counselors because I am not a counselor. I always like to say that right away. So we're seeing a lot from the isolation and the change in the education system. So we're seeing anxiety provoked by the new changes in education, but also by that isolation. We're seeing depression among the children, but we're also seeing changes in the normal behavior, anything acting out or misbehaving, binging, eating too much, playing too much video games, if there is such a way to manage that. But binging on like a Netflix program or something like that, there's a number of things. And then, of course, the family outbursts. If you're having more outbursts or that's not typical with your children, that's something we're seeing a great deal of as well.
But if it's not so blatant or obvious, what are some simple things parents can do to identify those kind of behavioral issues?
So, I was a single father. I am a single father, adopted and raised 4 special needs kids. And one of the key things, and my clinicians back me up on this, is just pay attention. Listen to what they're saying, what are they truly saying. Observe what their behaviors and what they are doing, what they're eating, how they're reacting. Are they regressing? Or are they getting too aggressive? Those are the changes in their behaviors that you will notice right away.
What about parents who feel this is just out of their wheelhouse and they can't really help their kids? Where do they go then to get help?
So there's 2 things. First of all, I would say it is not out of the parents' wheelhouse. I want to keep that with the parents as much as possible, and they need to be a big part of whatever recovery that child needs. If just by stabilizing their lives, making sure their nutrition is the same. Just because we have changes in our lives doesn't mean that their bedtime shouldn't be the same or getting up shouldn't be the same. If they need help, there are a number of agencies in Southern Nevada. We have 2 locations in Las Vegas, and we provide services to all ages from 3 years up to any senior. And we provide those without benefit of cost. So if they can't afford to get that treatment here under their insurance plan, or the copays are too high or what have you, we will work with all clients. We don't refuse service for anybody.
Well, that was my last question. I assume there's some sort of a sliding scale for those who are struggling financially.
There is, and we have grants as well. So I'm always writing other grants because not everybody has insurance and not everybody qualifies under their insurance program. So we have a variety of funding sources as well. And I didn't mean to take the answer out of your question before you speak up to ask it, but you're absolutely right. There's a number of funding sources to do that. But I think the important part is get the child into treatment, make a phone call or look on our website to figure out where we are and how you can get connected with us. But remember, you're going to be a big part of that, and families are important. So a child isn't doing that usually on their own. Often family therapy is also important as well.
So true. Thanks, David Robeck, CEO of Bridge Counseling Services. Thanks for your answers on this. Thank you for watching this 13 Connect special. If you missed any part of the program, push the back button on your remote and scroll down until you see KTNV Digital Exclusives. There you'll find this and all the specials we publish every week. Stay tuned for more from 13 Action News after the break, and check us out anytime on KTNV Streaming, Las Vegas News on your time.